Hi, my name is Dr. Peters with Peters Wellness Chiropractic in Goodyear, Arizona. This week's quick video is discussing arthritis. Now, when we talk about arthritis, we're talking about different forms of arthritis such as osteoarthritis, rheumatoid arthritis, psoriatic arthritis, septic arthritis, and of course gout. Well, just a quick description. Osteoarthritis, so osteo is bone, arthro is joint, itis is inflammation of, so osteoarthritis is inflammation of the joint where the bones come together. So whether we're talking about vertebral arthritis, you can see actually in the background of my video is the subluxation degeneration chart. There's a cervical, spine, thoracic, lumbar, and just looking at how those joints, as they begin to degenerate, how you'll start to get osteophytes, or the little bone growths that's turned into syndesmophytes and they fuse together, and then you get more and more restriction and lack of mobility, and of course lack of living your life the way we would want to, with enjoyment and playing with, well, not only our children but our grandchildren and maybe great-grandchildren in the future. So talking about how do people care for themselves when they have arthritis? What do doctors do for their patients? Well, one would be prevention. Prevention would be fantastic. Now, when you look at rheumatoid arthritis where you have an autoimmune issue, obviously that's going to be a little bit different. But most of what I see in my office is osteoarthritis, where in a lot of cases it is preventative. Now, if you've been in 5 car accidents, none of them have been your fault, where you're getting rear-ended, and maybe you played football or you were a cheerleader and got dropped from the top of the pile. These kind of things, I mean, injuries happen. Obviously, you're going to degenerate faster if you don't go up above and beyond, out of your way to care for yourself after such types of trauma. So let's talk a little bit about medications. Over-the-counter medications such as acetaminophen. Looking at that, you know, what are some of the risks? You know, everything has risks. Driving your car has risks. You know, what you eat has risks. Everything can cause this or that. So we just want to make healthier choices. Acetaminophen, increased risk of hypertension, increased risk of asthma, increased risk of intestinal problems. Also, acetaminophen is the leading cause of acute liver failure. So obviously if you're taking it here and there, it's not going to cause your liver to fail. But if you have constant pain due to inflamed joints for 10 or 15 years and all you're doing is taking some over-the-counter to help with that, that could cause some serious issues. So another thing would be NSAIDs, or non-steroidal anti-inflammatory drugs, such as aspirin, ibuprofen, naproxen. So these things can cause GI problems, nausea, upset stomach, peptic ulcers. So also I think the biggest risk there is increased heart attack. So we don't want to increase our risk of heart attack. So many people are having issues already. Opioids is another choice. Again, nausea, drowsiness, addiction to those such medications. So medication-wise, yeah, it's an option. It's something to do. Let's talk more about chiropractic-wise. Obviously, with chiropractic, we're going to talk nutrition, exercise, ergonomics. Exercise-wise, you're going to want to have aerobic exercise, resistance training, and of course stretching. You know, the foam roller, I love foam rollers. They work fantastic. Also, nutrition-wise, just real quick, omega-3 would be a great one. Glucosamine, chondroitin sulfate, you've heard of those. Turmeric, vitamin C, vitamin D, and then of course hot and cold if you're having flare-ups. So just, you know, educate yourself. Read about it. Go on YouTube. Watch different videos about specific nutrition, about specific exercises. And also just, you know, get a book. Go on Amazon and look for books on how to help yourself if you suffer from arthritis. And of course, see your chiropractor. Go in and get checked. So that's this week's quick video. We'll see you next time.